and thank you for joining us. We're going to talk about the truth and the science of bioactive bioceramics. And I'm going to be your host for this meeting. My name is Carolyn Primus. I'm an engineer. I'm going to talk to you about the science behind bioactive bioceramics for pediatric dentistry. And I thank you for taking the time to join me for this hour-long session in which we go over some of the science, including definitions of bioactivity in dentistry, MTA, and its synonyms. So let me tell you about bioactivity in dentistry, MTA and its synonyms. We're going to talk about the history of materials used for pulpotomies. Then we'll have a brief session about discussing all the bioactive bioceramic dental products that are available to you and give you a framework for you to choose a bioactive dental product for your practice. And last, I'm going to introduce NeoPutty, a new product from NewSmile, to you. So thank you, NewSmile, for hosting this. And if there are any problems, I hope you're reporting this to the chat box. By the end of this webinar, I want you to be more well-informed so that you know that any of these myths that I've listed up here on this page are simply that, myths about what MTA is. So let's get into that, and we'll cover this also at the end as a part of the wrap-up. Because I'm a material scientist, I like to use this framework to start, where all materials in our world are either composed of ceramics, organic, or metallic materials. But biomaterials can be any of these categories. And what we're going to focus on today is specifically the ceramic materials that are shown over here and the biomaterials that are ceramic. All the MTA products that you have heard about are bioactive bioceramics, and you'll understand that, but I want you to have a category for this. Bioceramics can include inactive or non-bioactive materials, including zirconia, alumina, or dental porcelain that you might have heard about. But the bioactive bioceramics include bioactive glasses, hydroxyapatite, calcium hydroxide, and especially the material we're going to focus on today, which is MTA. And chemically, I almost think of it as tricalcium silicate. So let's delve into this a little bit more about what is a bioactive material, and then we'll talk about why it's important to you in your practice. So bioactivity is defined in international medical and dental standards that relate to materials that are implanted in the body. And the key thing about a bioactive material is their ability to form hydroxyapatite or a bone-like mineral in the body when they're either exposed to synthetic or actual body fluids. So I want you to have a picture of this, and we can look at this scanning electron microscope on the right, where it almost looks like a flower arrangement of hydroxyapatite crystals that formed on the surface of an MTA. And they are similar to bone material, but not precisely the same. They may be a little deficient. They may have some other ions, but they really in the body function in this way of bioactivity that has some benefits that I want to show you. So for pediatric dentistry, bioactivity is most commonly imparted by tricalcium silicate powder. What this is, besides that chemical name, is a very fine ceramic powder like I'm showing you on the right. It's white. It's usually blended with some other ceramic powder that makes it radiopaque for X-rays. It's colloquially known as MTA, or mineral trioxide aggregate. I'm going to use that term MTA type materials in this lecture, but there are also some materials, other names for it. And I want to introduce you to those so that you will be more well-informed and you're not going to be confused by any manufacturer about the synonyms for MTA. So chemically, what we're talking about is tricalcium silicate and often they contain dicalcium silicate, two specific ceramic compounds. And the unique thing about these compounds is, unlike a lot of other ceramic powders, they are hydraulic, so they react with water. These materials are generically called by material scientists calcium silicate cement. But dental companies have also called them bioactive bioceramics, including these companies, or another marketing term that's been used by Septidont for their biodent materials is biosilicate. Now, some people have tried to further confuse dentists by saying these are just Portland cement. But from my point of view and my training, Portland cement is really used to denote construction cement. And dentistry has carved out something different than construction cement, because when you buy Portland cement, it's really impure. It's very cheap. It's an industrial grade material that's used for construction. It's a very coarse powder that no dentist would like to use for a cement. Portland cement for construction is designed to set slowly, so you can mix it and take it to a construction site and use it there for pouring. It's not radiopaque, it's not FDA clear, it doesn't meet the ISO standards for dentistry, so it's really not suitable. However, chemically, all the MTA-based products do contain the same chemical that's used in Portland cement, but really manufacturers are using a medical grade device. And that's true for all the products that I've listed down at the bottom. But you can think about this in the same way that we think about dental acrylic. In dentistry, a lot of methacrylate is used, but it's not the same as nail acrylic. Dental acrylic has to conform to various international and ADA standards, but it's quite different. And you would never go to your nail salon to get your dental acrylic. It's the same sort of philosophy. So let's go back now that you know that MTA can be known by several different names and see how it fits into bioactivity. As I said, it's a mixture of ceramic powders, tricalcium silicate, dicalcium silicate, or radiopaque agent. Depending on the material, various things may be included, other ceramic powders, including calcium carbonate. But all of these products are going to set with water. And when they set, one of the reaction products is calcium hydroxide, a well-known bioactive material in dentistry. And you can see it within the cement matrix that's shown over here on the right. These light gray areas are the cement particles, and they're surrounded by a darker gray matrix in which the calcium hydroxide is present, and the hard part of the hydrated silicates. The little white bits that you see in this SEM photograph are the radiopaque powder that's dispersed with the other cements. So we create a hard matrix. Okay, and then how does MTA become bioactive? Well, as described in that international standard, that calcium hydroxide creates a very high pH, and that high pH causes phosphate to precipitate out of the body fluids, forming a calcium phosphate layer on the surface of the material. That layer is recognized by the body as natural, not as a foreign body. A healing can ensue as a result of this. So I want you to really visualize this in another way, sort of macroscopically. So I want to show you this sample from an endodontic experiment where a root end was resected. The root end was filled with gray MTA or pro-root MTA. Then the tooth was soaked in synthetic body fluid. And after a few days, we sectioned it sagittally, and you can see this white layer that's present on the tip of the over the gray material, which is the MTA. And that is the hydroxyapatite that's formed on the MTA. So it's just like that diagram that I showed you, and it has some benefits for helping the body heal, in this case, the apical tissue, or more commonly for pediatric practices is getting tertiary dentin formation in a pulpotomy. So here's a histological section that I can show you where we had MTA that was closely approximated to a pulp. And then after a period of time, the MTA cause the pulp to react and form tertiary dentin. And we can see this in this histological photo that was taken after the histology about 60 days after the procedure was formed. And that tertiary dentin is, of course, a protective barrier to the pulp. So back to try and tie this together, the MTA products I was showing you that are quite common in dentistry do contain tri and dicalcium silicate powder that varies from about 35% to about 92%. And then the bulk of what else is in the powder is a radiopacifier. Originally, bismuth oxide was used, but now people are using tantalite, calcium tungstate, and even zirconia is popular, and barium zirconate. Let me make a couple of points that products with bismuth oxide are well known now, especially in pediatrics, to cause discoloration. And this low amount of tri and dicalcium silicate powder in these particular materials is attributed to the presence of about 1/3 of resin, which dilutes the material in its bioactivity. I want to share this snapshot from something that inspired me to develop Neo-MTA, which was a study by Professor Seal and her graduate students showing that if you put MTA in a pulpotomy and then restored the teeth with a composite rather than a stainless steel crown, over time, the teeth darkened remarkably, even though over here you can see that the radiographic findings were that the tooth was healthy. Well, I thought about that, and that's how Neo-MTA came to be developed. And that also speaks to not using products that contain bismuth oxide. Okay, you know all about pulpotomy treatment. You know that formocresol, ferric sulfate are popular. There are other materials that are used, other techniques, including things that are as revolutionary as bone morphogenic proteins. But these materials are not, that I'm showing you, are not bioactive. So MTA is really replacing all of the formerly used medicaments for a number of reasons. Excellent biocompatibility, the formation of calcium hydroxide during setting, which leads to the alkaline pH, the calcium ion release, the bioactivity, which is going to support your reparative dentin formation. These products are radiopaque, non-shrinking, and the non-shrinking gives you excellent sealing. So the motivation I've shown you about how it looks histologically, and here's a case report from a colleague in which we see trauma that occurred, and 12 months later after treatment with MTA, there was continued apical formation and healing. So that's really what motivates us to use this sort of material. And in fact, the AAPD guidelines on pulp therapy do mention for direct pulp capping and partial pulpotomy, caries or trauma and apexification, the use of MTA with a high rate of success for pulpotomies. And it seems to perform as well or better than the most popular medicaments that are out there, and could be the material of the future, which I certainly believe. So a lot of people, including using this author Silva et al., consider MTA to be the new gold standard for pulpotomy in primary teeth. and it surpasses calcium hydroxide. Now, both in the previous slide about the AAP guidelines and here, they are using the term MTA. But as you know now, that means tricalcium silicate containing products. So let's talk about some of those products that are quite popular. There's ProRoot MTA. That was the original. It does contain bismuth oxide. MTA Angelus also came out in white and gray versions, also containing bismuth oxide. Then there was Biodentin, which doesn't contain bismuth oxide, but it's kind of pale on a radiograph. The expensive endosequence materials, and Neo-MTA2, which was designed with pediatric dentists in mind. And then there are some other materials are from outside, also from outside the US. Now, I have segregated all those on the right from the MTA products that contain resin on the left, because the resin is a diluent for the bioactivity in my mind. So let's move on and discuss the bioactive products. And just to reiterate, all of these materials contain the same bioactive ceramic powders, the tri-endowed calcium silicate and radiopaque materials. But this leaves you with, this is a myriad of products. How do you choose a bioactive dental material? And I want you to hear about this so you have a context for both choosing a bioactive bioceramic dental material, or perhaps you'll use the same principles to choose some new bonding agent or composite material. Do you think about the composition, the format of the product? How does it handle? The speed of setting? The radiopacity? Does it seal or does it shrink? Does it discolor either immediately or long-term? What do we know about biocompatibility and the ultimate clinical response? Do you need a versatile material, or do you need it specifically for one treatment that you perform? And perhaps the overriding cost is your most important consideration. So let's look at these individually. When it comes to composition, you've already seen that they're all based on tri and dicalcium silicate. When it comes to the format of them, some of these products are offered with sort of a bulk packaging of a desiccant bottle of powder compared with a dropper tip. That's the New Smile Neo MTA2. Biodentin has capsules of powder and gel. ProRoot MTA uses foil sachets with little vials of water, and the Sprig Smart MTA uses plastic vials with for their powder. I've studied the packaging quite a bit for dental materials over my 30 years in the field, and I really like the desiccant powder bottle because it's going to protect that very precious powder that you're buying from ingress of moisture, which is going to cause premature setting. And you may not realize it, but even plastic vials allow ingress of water. And you may know this because you've had freezer burn of things you've wrapped up in plastic and then they desiccated over a period of time. Washout. Washout is a feature that may be important to you, especially if you place a material and then want to do your crown prep. We've tested the Smart MTA material and found that when you go from before and after a test, that the Smart MTA material can become completely washed out. And this was done after 3 minutes after mixing and placement, which is supposed to be the setting time for this material. In contrast, Neo MTA2 did not wash out when tested in precisely the same way. So you should think about whether washout resistance is important to you versus having a very short setting time. And a longer working time can add to both convenience and efficiency of your practice. So let's spend a minute more on setting time for MTAs. And the setting time for New Smile Neo MTA is around 14 minutes, really not substantially different than Septidont, uh, Angelus, and certainly shorter than the ProWord MTA, the original material. The Spriggs Smart MTA does set more quickly, but certainly not at the 2 minutes and 30 seconds when we did the ISO test for initial setting time. So the next quality that we talked about was radiopacity. And radiopacity is really handy for you to know that your material has been placed and it was stable. The new Smile Neo MTA2 product is substantially more radiopaque than Smart MTA, Biodentin, and the TheraCal PT or TheraCal LC products. When it comes to sealing, the great thing that has been found for the MTA products is that they're very dimensionally stable. And that's the whole reason why Portland cement type materials or tricalcium silicates enable us to build tall buildings, because when you pour it, they don't shrink and they don't expand. And that's a benefit over the materials you often use, which contain resins, which always shrink. In fact, there's a tiny bit of expansion that occurs with the most MTA type materials. And that stability is what contributes to sealing the dentin, which is the crucial reason why you're using this material for contact with either the dentin or with the pulp, so that you will protect those tissues. Now, some people have, lecturers have brought up that there won't be a bond of MTA to composite, and that is correct. But you don't need the bond to composite. You need to place a restorative material over MTA and seal the margins. But MTA is doing its job of protecting the pulp. I told you that bismuth oxide can be problematic, and I wanted to show you an experiment that was done with various bismuth oxide compounds shown here on the left. And it's a problem in that study by Professor Seal because of light penetrating the primary teeth, and the bismuth oxide, the bismuth compounds will discolor after spending some time in the sun. And you can see they go from very white to gray to orangish. That's unlike tantalum oxide that's used in Neo MTA. And the same thing has been observed for using sodium hypochlorite, where we can soak MTA materials in water, or if we soak them in sodium hypochlorite, the original MTA containing bismuth oxide turns a very, very dark brown. So let's talk about the next attribute that you may be interested in, and that was about biocompatibility. And the highest level of biocompatibility is a human clinical test. There are quite a few tests that have been done and that are really very nice, especially with primary teeth. But this is one for adults. It was an RCT, and it was a comparison with calcium hydroxide. And the MTA was better than the calcium hydroxide in this in this pulp capping indication that's diagrammed here. And why might that be? Well, in the MTA, when assessed, we've got both the calcium hydroxide and we have a hard matrix that's holding the calcium hydroxide in there. There have been several studies to show that former cresol versus MTA, it's at least equal, and continuing data is accumulating to show that MTA is really superior in the histological response. And this is, yes, this was about just gray MTA material. Thinking about this, we're getting the clinical responses because of the chemistry that's associated with tricalcium silicate. And I showed you that Biodentin also has tricalcium silicate. So in this study of pulpotomies in primary molars of MTA, or it was ProRoot MTA versus Biodentin, they were equal. And I would have predicted that because they have enough of the bioactive cement in both products to be successful in protecting the pulp and inducing that bioactivity. Now, I have a different opinion about the resin-based MTAs because resins have to cure, and it's never 100% cure. What I worry about, and I thought about this from 20 years ago when I was formulating white MTA, is that the residual resins can be cytotoxic, the monomers that remain behind. And I really don't want to take up the space in a formula that uh, your formula has to add up to 100%. And if you use 30% resin, then you have that part of the composition is not bioactive cement. Resins also coat the cement particles, reducing the release of ions that we need for bioactivity. And these resin products that I've showed you really have fewer indication than the MTA products on the market, so they're less versatile. And I also showed you how they're not as radiopaque. At this point, I hope you agree with the statement by Dr. Bogan, who was an early adopter of MTA for pediatric dentistry. And he said, the question should not be whether the benefits of MTA justify the cost, and the costs have come down since he wrote this, but can the cost of not using MTA be defended in light of the evidence, the science, the truth about MTA that shows its superiority and its long-term survival? So I hope you answer that for yourself now. And I want to spend a minute on versatility of the New Smile Neo MTA, which is cleared by the FDA for both pulpal and periapical tissue contact, which leads you to a material that you can use for all these sorts of indications here, which may occur in your practice. So spending a little bit more time on Neo MTA or that you may be using, or the new product by New Smile called Neo MTA 2, they're very similar, but we listened to the pediatric dentist and developed Neo MTA 2 to be easier to mix, whiter, having a higher radio opacity, being as multi-purpose and still remaining cost effective for you to use. Now, between the two materials, they both have bioactivity, excellent handling. They are relatively quick setting compared to ProRoot MTA. They have washout resistance, and they will never stain the material. They're versatile, like I showed you all those indications on the other slide. So you can have one material in your practice to do a lot of different things. And they do have the lowest cost per dose of all MTAs, partly because of their bulk packaging here. And you can see the powder bottle and the gel bottle and the ability to use a larger or smaller scoop for the procedure that you need. So that smart packaging leads to the lowest cost per dose of the competitive pediatric MTA type materials, less than $5 each. When you think about the Sprigg Smart MTA, which is saying it's good for 2 teeth, the problem is that you have to divvy out that material from one vial. So that can be a little bit inconvenient for you. We have frequently asked questions available to you about how you can use Neo-MTA, but when I'm there live at the AAPD, I'm sure I've met a lot of you and discussed how to mix Neo-MTA. Look, if you can make pancakes, you can mix Neo-MTA. It's not magic. If you make it too thin, like a crepe, all you do is either, if you have the time, let some of the water from the gel evaporate, or add a tiny bit of powder, not a whole scoop, a tiny bit. If your assistant has mixed it and it's a little bit crumbly, they need to add just a tiny bit of gel and it's less than 1 drop. Now, this may sound complicated, but surely you can manage that. And I want to assure you that this is no more complicated than using Biodentin, where you have to decide on how many drops you're going to dispense. And unit doses, believe it or not, in any product do vary. So this is really not unique to the Neo MTA2 product. So let's go back. That takes us to the summary of how does a clinician choose an MTA product? I listed all those things, so let's go over it. The composition, you've learned, they're mostly tricalcium silicate based materials. They can be in their format either pre-mixed or two-part. They can be unit dose or bulk of packaged material. Some of the materials vary in their handling, like the Angelus powders are more coarse than the some of the other MTAs. I showed you the idea of washout, which may be important to you. The speed of setting goes from about 10 minutes to 2 hours, but you know, they're not as fast as the materials that you may be used to in dentistry, more like impression materials. The radio opacity varies. It goes from low to medium, not as high as some endodontic sealers, but adequate. The sealing for this type of material is excellent because they expand just very slightly. If you avoid materials that contain bismuth oxide, you'll avoid discoloration of the tooth over time. All these MTA-based materials are bioactive, they're biocompatible, and the clinical response is excellent. I haven't read any clinical trials that show that one material has a superior clinical response over time in humans over others. The indications vary widely, but please note that they are used subgingivally or intercoronally. They're not suitable for long-term use as a restorative. The cost varies widely, and some are less than $5 a dose, but there are other materials on the market that are more than $30 for a dose. So you have to factor in all these things when you choose a material. I've gotten pretty close to where the end of my presentation, but I am really excited to introduce this new product to you called Neo Putty by New Smile. And it was really a pre-mixed paste that was designed with the pediatric dentist in mind, considering continuing that theme from Neo MTA to Neo MTA2, now to Neo Putty. It's a beautiful box with this syringe that's packaged in an aluminum tube within this box. I think you'll really find it fun. But you may be at this point wondering, well, what about Neo MTA2 versus Neo Putty? You're going to have to make a buying decision this weekend. And there are some similarities. Both products contain extremely fine hydraulic tricalcium and dicalcium silicate powders. They are bioactive bioceramic materials. They release calcium and hydroxide ions, but they're both resin-free, so we maximize the bioactivity. When placed in the body, they'll create an initially high pH, which leads to the bioactivity. Both of them are color stable, non-staining, and they both contain tantalum oxide for their radiopaque ingredient. They're immediately washout resistant. They have low water solubility when they are set, and they're dimensionally stable. Now, Neo-MTA2 differs from Neo-Putty because the putty does not require the mixing. It is slightly more radiopaque than Neo-MTA2, and it comes in a syringe format, and that syringe has zero waste because of a unique plunger design. So when you get to the end of the syringe, there's no leftovers. So it's very efficient in that regard. So let's look at that syringe again and just emphasize a couple of features. This putty was really engineered and tested with pediatric dentists to ensure that it had a firm, non-tacky consistency that was suitable, especially for pulpotomies. It's pre-mixed to eliminate prep time or training, and it does have this higher radio opacity. It's reliable, versatile, non-staining, and it also allows you with this skinny syringe to dispense exactly how much you need. It's going to be washout resistant and it's going to be stable. You may be asking, what are the properties of Neo-Putty? Now, this is important to think about because it's a ceramic powder that is suspended in an organic liquid. So because it doesn't have water and you're not mixing it with water, it has a longer working time at room temperature after you dispense it. But it needs water from the body to set. So you put it in the body and it's going to require some time, about 4 hours in our ISO test method to set. But it's not going to, and once it sets, it's not soluble, it's stable, it's radiopaque, and of course, it's very pure for those reasons that I mentioned that distinguish it from Portland cement that's the construction grade. I have a little graph building on what we had before to add the New Smile Neo-Putty, which has a higher radio opacity of about 8.1 millimeters of equivalent aluminum, higher than the competitive materials. But Dr. Jorge Cassian has been kind enough to test this material for us and gave us some case reports. In this case, he restored teeth ENF, and he used Neo-Putty, which can be seen through the zirconia crown. So he put the Neo-Putty here, you can see it in the radiograph on the left, and on the right, you can see the shadow of the Neo-Putty on the right. Here's another case, courtesy of Dr. Cassian. And in this case, he had a trauma case, and he did a spec pulpotomy using Neo-Putty. And you can see the white Neo-Putty right down here, and in the radiograph over here. And this was a new case, and later on, he's going to restore the lateral incisor. But its radiopacity is pretty dramatic there. The last case from Dr. Cassian shows a pulpotomy with a stainless steel crown that is placed on a primary molar. And of course, you achieve hemostasis before you place the Neo-Putty, just like you do with like you should do with any MTA product or any pulp medicament. And he cleverly put in some of Neo-MTA in one part of the pulpotomy here on the left and on the right, sorry, and the Neo-Putty was placed on the left. And if you look closely at this radiograph, you can see the greater radio opacity of the Neo-Putty. He said he liked it. He loved it, and he liked the handling of it. So that was very pleasing to me. So Neo-Putty is going to be available through New Smile. You can either get a starter kit at 0.65 grams, or you can get the professional kit that includes 2 syringes, so you get 2.4 grams of the putty in one kit. Each will be in its individual aluminum tube for storage in between procedures. Okay, I've talked to you about a lot of things regarding MTA. Now you know that MTA products are bioactive bioceramics. You know that chemically they're based on tricalcium silicate. You know that that there are several other names that people have used for the MTA type products. I hope that you see that MTA is a very worthwhile product for use in both endodontic, general dentistry, and in your field of pediatric dentistry. People are seeing now and recognizing that MTA is better than calcium hydroxide as a medicament or many other medicaments, including formicresol and ferric sulfate. So it's radiopaque. You know what it is chemically. If you avoid materials with bismuth oxide, you won't get discoloration. And in particular, the new Smile products that are being shown today our Neo MTA2 has a suitable working time and setting time that's much shorter than the original MTA. So it's designed to be convenient for your practice. But both products that I've mentioned, Neo MTA2 and Neo Putty, do not discolor. They're easy to handle. They're going to be stable when you place it, and they're going to be cost effective for all the practices and really the standard of care that people should be striving to offer all their patients around the world. So it has been very kind of you to spend your time with me. I want to thank New Smile for this opportunity to talk about the real science behind bioactive bioceramics. So now you know more about MTA. You have a framework for choosing MTA products or other dental materials, and you're not going to be fooled by any manufacturer about what it is that you're going to purchase to give you a bioactive dental practice. Thank you very much for your time.